Well, hello and welcome to tonight's global webcast. Again, managing cortisol and diurnal hormone fluxes. Your speaker tonight is James Lavalle, clinical pharmacist and board certified clinical nutritionist with over 30 years of experience in wellness, prevention, and disease state management. Jim's the author of 19 books, including his most recent book in 2013, Your Blood Never Lies, and Cracking the Metabolic Code, released in 2004, a breakthrough publication in understanding overall metabolic function. To learn more about the Metabolic Code and the Metabolic Code system, be sure to visit metaboliccode.com. So much more to say, but without further delay, here's Jim Lavalle with Managing Cortisol and Diurnal Hormone Fluxes. Take it away, Jim.
Great. The big thing I want to do tonight is I'm going to hit on a couple of things that are maybe out of the norm for what everybody thinks about on cortisol, because we're obviously going to talk about how to use adaptogens and how to use adrenal extracts, and those are the basic things that you guys have been learning about for a long time. But I want to paint a little bit different picture on cortisol and what is going on and what may be some things you should be considering when looking at that cortisol individual, that hypercortisol individual. So, okay. So the first slide I want to go to is this slide of the clinical effects of this excess HPA. I think this really sums up what you're trying to manage. And it's one thing to sit there and try to manage, okay, someone's cortisol's up or down or the diurnal pattern's off. But the problem is that there's so many things that stream out of increases in cortisol. And, once again, there could be people that have artificially suppressed. I know you've learned from Dr. Haven, and I know he's going to be speaking, I think, next time on the next webinar, that you learn that infections can alter cortisol. But the big thing that I want to talk about is cortisol elevation. There's a lot of things that start to shift. And if you look at the top of this slide, the decrease in neurogenesis. So just keep in mind, and I'm going to kind of pull up a few of these things that are associated with it. But the decrease in neurogenesis is simply that, progenitor cells don't bud, you don't get neuronal rebutting, and therefore you damage your ability to repair your brain. Now, in addition to that, you have immune function issues, right? So obviously, and I know Andy's done a lot of work talking about this, but things start to shift as your immune function is altered from cortisol. Now, and tonight we're not going to go through that too much, other than as we talk about the plaquing processes that go on with changes in cortisol. But the big note is that more than likely you're shifting your immune system to a more immune-activated pro-inflammatory state. Probably the big thing that people don't really think about is the fact that a lot of times I see these IGF-1 measurements that are low, growth hormone starts to dip. You get significant changes in growth hormone and IGF-1 and growth hormone releasing hormone when your free cortisol is going up. And then, of course, as you look to the right of this particular slide, you see luteinizing hormone goes down, changes in estrogen metabolism, and changes in testosterone, which, once again, the people that are either overworked, either due to, lots of stress due to physical activity or mental activity, that excessive free cortisol dramatically affects testosterone. What's the outcome of this, though, that's so important? Well, first of all, as cortisol goes up, so does epinephrine and norepinephrine. You get an increase in blood pressure, and leading to a lot of resistant hypertension. So, the blood vessel dynamics change, endothelial function changes. That's important. The next thing, of course, is insulin action changes. And then the obvious of the abdominal visceral adiposity. I mean, we've all heard about the effect of cortisol having an effect on visceral fat accumulation. One of the things that I think you'll find interesting is like fat around the heart. There's a particular compound, and I know we talk about a lot, that just had a recent study that showed that it actually reduced the fat around the heart. And pretty excited to show that, because these are brand new clinical findings that we're going to share tonight that just recently got presented and are going to be published here shortly. What's the outcome of this cortisol? So when you're thinking about managing cortisol, the first thing I think about is, you got to think about bone density. You have to think about muscle loss. You have to think about the fact that they're going to begin to be pre-hypertensive, that they're going to begin to be pre-diabetic. So basically, the syndrome X or metabolic syndrome chemistry starts to play out. They get cognitive decline. I know I just had an executive, 45-year-old executive, his testosterone is waning low, his cortisol was high, and perfect example of a guy who, this is just 2 weeks ago when we first did his workup, got home at night, stared into the TV, had no energy for his 3 kids, all under the age of 10, really didn't have the focus that he had, noticed changes in his body composition, and, 5 days into giving him a regimen, energy's better, not sitting on the couch. There's big changes that you can do when you know what to do, but this happens a lot. It's just not the frail person. It's that executive that's pounding themselves hard, sometimes 60, 70 hours a week, and they begin to exhibit some of these things. One of the big things that I look for is pH. So, look at the pH of their saliva, find out whether or not it's acidic or not. If it's acidic, they're losing bone. If you're losing bone, you're plaquing arteries. We know that a decrease in bone mineral density leads to arterial plaquing. And so I look at our talk in this next hour, what do you really do to try to help manage some of this? And maybe look at a couple of different products and ingredients that you guys may or may not be familiar with, and how do we successfully apply them? And of course, we know these things, but I just want to review them real quickly. Bone mineral loss, sodium and water retention, blood lipids get changed, and we're going to go through that in a minute. You lose REM sleep. That's really important. We'll go through that in a minute. You get increased plaque formation, obviously increased insulin secretion and less insulin action, more muscle wasting, all the things that I kind of mentioned before, but it's just summarized it in a different way. And, this is, simply a graphic, right? It goes from the brain down. This is what Andy talks about all the time. When you start to lecture on the HPA axis, it really is all about the fact that you get an inappropriate response to the HPA axis. The hypothalamus starts to take on excessive stress mediation and starts to alter the flow to the pituitary and the adrenal glands. And you start to get stuck in excessive cortisol release, excessive epinephrine and norepinephrine release, which of course alters the dynamics of the vessels. And obviously, as the cortisol is going up and insulin goes up, insulin also affects epinephrine and norepinephrine. So we get this kind of double whammy effect on the vessels with the excessive sympathetic stimulus. And and the big thing about this flattening of the cortisol curve, of course, is that you upregulate IL-6. And while IL-6 is good to upregulate, say, post-exercise, it's not good to stay upregulated in a chronic way because it leads to chronic immune activation, leads to fatigue, it leads to muscle energy losses, mitochondrial deficits. And I know I use this slide a lot, but I just want to just kind of review this again, that stress response hitting the sympathetic nervous system from the hypothalamus through the spinal cord ends up communicating through the enteric nervous system the changes in permeability in the gut, meaning that we release more histamine, the histamine gets released, release more, and as you release more histamine, you end up getting more and more leaky gut behavior in the immune system, which as you look on this slide, it triggers inflammation and immune activation. So if you go from left to right and follow this, you can see this is the situation. And a lot of times we don't recognize that this is going on, and it's why it's so important. When I have people that are allergic, a lot of people that are histaminic, people that are dermographic, I'm thinking their gut has gotten leaky, but if all you do is give them a leaky gut protocol, you're not getting to the bottom of the situation, which is typically at least involved in some way an HPA axis activation that's taken place. And this is, of course, how a normal cortisol pattern should look. And what I'd invite you to think about is we're going to break this down into 4 sections as to where what supplements work and when. So, we think of morning supplementation, noon supplementation, 3 to 5 p.m. supplementation, and night supplementation. And we're going to kind of go through that with some nutrients when we get to it. I just kind of want to set the stage and get a little refresher on what we're trying to accomplish with modulating cortisol. And of course, this is what happens when it flattens. And if you've listened to our lectures in the past, you know that flattening of the cortisol curve leads to heart disease and cancer and all sorts of other problems. MS, autoimmunity, a lot of different problems occur when the cortisol gets flattened. interestingly, when that cortisol pattern is, flat and low or flat and high, really doesn't make a difference. It's the fact that you lose the diurnal pattern. Now, I know many of you probably listened to Laura talk last week about the Metabolic Oh Diet, and I'm not sure if she went through this or not, but one of the interesting things that when I did a study on keeping the carbs low during the day and having your carb at night, and people that were overweight, that it helped to reset both the cortisol diurnal pattern and also leptin regulation. So I just wanted to bring that up as a side note because I know that Laura's diet talk last week was pretty well received, and that's one of the reasons you use the Metabolic Oh Diet, because it's trying to reset the different diurnal variations that are going on when they get out of balance, when people have MET-S and people have excessive cortisol response. And this is just a few slides on cortisol and cardiovascular disease, and what this is leading up to is actually the research on aged garlic that just recently came out, as well as on resistant starch, super starch plus protein plus branched chain amino acids that just came out, that was studied at the Joslin Center at Harvard at the Diabetes Center there. So this is, of course, cortisol causes small dense LDLs, promotes endothelial dysfunction, production of procoagulants in the endothelial cells. So when you think of people having high cortisol, just don't think about them being anxious. Think about them being the people that are plaquing. They're the people you want to think of right away. What strategies am I using to improve the endothelium? I need to reduce their myeloperoxidase. I need to reduce their oxidized LDL. I got to reduce their deoxyguanosine. I got to think about that endothelial function in their blood pressure. Are they somebody sitting there at 135/85 consistently? So they're just starting to get that sympathetic drive kind of going and dominating their vasculature, and you want to be acting on that. And so this is one of the key things that you want to be thinking about. So it's a pretty interesting concept, right? I start thinking about magnesium right away when I think of cortisol, because when your cortisol levels go up, your magnesium pool drops because you need magnesium for your bicarbonate buffer. We'll go into that later, but I just want to kind of dial in, and you got to understand that when you see people with altered cortisol, either high waking cortisols in blood or a 4-point salivary cortisol that's flattened or is elevated, or they've already went through elevated and depressed, you want to be thinking about their vascular health. The same thing, this is another study, and if you look at the title of the study, the hypothalamic pituitary adrenal axis activates as a predictor of cardiovascular disease, type 2 diabetes, and stroke. My point to you is that when the HPA axis is activated and you're in a hypercortisol state, or you've already been through the hypercortisol state and now you're in hypocortisolism, you have to be looking at their lipids. You want to look at their NMR lipoprofile. You can see it through their LDL particle number. You can see it through the type of HDLs they're making, and you can see it through their oxidized LDL. All of these things get influenced when your cortisol levels are going up. And this was just a study that showed that, as cortisol went up, 62-year-old men, no prior evidence of heart disease, much higher high sensitivity cardiac troponin when cortisol was elevated. So, this was basically mental stress and what happens in plasma. The next study showing that salivary cortisol levels at baseline and 3-year follow-up. So the higher the cortisol levels, the higher the risk of coronary artery calcification. I think it is amazing that the 4th study on aged garlic just came out, and Dr. Budoff actually showed a reduction or a reversal in coronary calcification. It's out of UCLA. It's reputable, great study. I just got the slide deck from him. I'm gonna pop it up when we get to it so you can see the data sets that he got on this last study. Hair cortisol predictive of future cardiovascular disease risk. Once again, when your person has got that high cortisol, be thinking about looking at a full cardiovascular workup. What are they doing? What's their heart rate variability like? What's their resting heart rate like? What's all their blood panels look like? And so when you looked at this, that hair cortisol was the strongest predictor for acute myocardial infarction. So, another study in obese children and adolescents. If you look at this again, this is even in children. That's why one of the things I do is, when we're working with kids, is we look at their cortisol levels, because a lot of times kids are afraid to tell you they're stressed out. But if you look at this, 450 obese children and adolescents ages 4 to 18, ACTH and cortisol levels associated with both systolic blood pressure, diastolic pressure, trigs, fasting glucose, and insulin. But in the summary, high morning ACTH and cortisol levels are associated with cardiovascular risk factors in children. And I got to tell you, it's more and more difficult for kids these days. I mean, they're expected to really achieve the pressures on them from the time they're in first grade on to build their resume to get into college. It's a different world, at least, than when I grew up. And then this is just cortisol and Med-S, right? So we know that when cortisol goes up, Med-S risk goes up. I don't want to belabor this. So I want to get to the strategies for us. Another hair cortisol, the higher the hair cortisol, the higher the prevalence of Med-S. So just another study showing it. Another study showing, once again, the higher the risk as cortisol goes up with dysregulation of the HPA axis, because with Med-S, it's highly correlated to HPA axis problems. So a lot of people with Med-S, they're overweight, they're prehypertensive, they have trouble sleeping, they have big problems with their cortisol. And once again, another correlation, 2013 with correlation to it. I brought this up because if you remember the first slide, I talked about the issues with growth hormone. And basically what happens is and I know I did a talk on sleep a few weeks ago, if you have trouble sleeping, and it's because of hyperarousal, and for those of you that were at the last talk, we talked about hyperarousal being a 24-hour phenomenon on your HPA axis. When your cortisol level is elevated at night, it causes when your slow wave sleep gets kicked in, so you go into deep sleep, that decreases corticotropin releasing hormone and increases growth hormone. So when you sleep deep, you get better growth hormone release. We're measuring all these IGF-1s and IGF-1B3s and all of these growth hormones, and we're not even asking people about their sleep patterns. Now, yes, it could be an infection. I got it. But I'm going to bet you, because I've done this a lot, I just had somebody get their IGF-1 to go up 75 points, correcting their HPA axis. So when you have chronic stress, it disrupts the diurnal pattern for growth hormone, corticotropin-releasing hormone, and ACTH. So you get an evening rise or nocturnal hypercortisolism. When you get sleep fragmentation, it drives more cortisol. When you get sleep fragmentation, you lose growth hormone. And so I still believe for a lot of people walking around who are under a tremendous amount of daily stress in their workplace, and then they have family stress at home. They have stress at traffic, right? The traffic's crazy. The emails are crazy. Look at tonight. To not being able to get on and present this. I'm sure my cortisol levels are going up. I'll have to take melatonin tonight, I'm sure. This is a big, big issue, but I don't think we look at the global pattern that takes place, and we don't appreciate what's happening with cortisol in that global pattern. So the sleep pattern's big, and then I brought this in because I know I brought this up in the sleep talk. So, if you guys were here listening to that, I know I brought it up, but when melatonin goes down because of high nocturnal hypercortisolism, you interfere with circadian insulin secretion, which is adapted to day-night changes, meaning that at night I have different blood glucose needs, and during the day, and my beta cells literally go through a circadian rhythm of releasing insulin. And so, in addition to obviously food load, so it's important to note that when your cortisol is off, you've got to get the sleep down. And I'd refer to you to just listen to the sleep talk, and you can kind of get that. And then, of course, sex hormones. Basically, when cortisol goes up, your thyroid regulating hormone goes down. So when your TRH, your thyroid receptor hormone, goes down, it increases your. When your TRH goes up, it increases your prolactin, that prolactin going up down regulates your luteinizing hormone, which of course causes your testosterone to go down, as well as your growth hormone. And this, I've used this study before. I think Andy actually gave me this study. This was the first study that showed, if you look at the bottom in the conclusion, it showed the cortisol testosterone ratio and the incidence of ischemic heart disease. There was a specific association, so that the higher your cortisol, the lower your testosterone, the more the risk of ischemic heart disease. But the only thing I'm going to say is, I think that only tells a part of the story. It's really, yes, it's true. As the testosterone goes down, you're getting a predictive risk, and that's real. I get it. That's why we study BHRT. But cortisol causes bone mineral demineralization. And so just the fact that you're demineralizing the bone, it causes more plaquing to occur. So it's really pretty elegant the way it happens. And I got to tell you, the interesting study that I'll show you on bone mineral density with aged garlic, they did all these different parameters at one time. I think is fantastic, and you'll see what I'm talking about. Bone health, obviously, as cortisol goes up, you increase lactate. You increase lactate, you get more calcium efflux from bone and more magnesium efflux from bone. Bone mineral density goes down. It gets worse if your vitamin D levels are low. So the bottom line is, more cortisol equals more stress fractures, more cortisol equals weaker bones, more cortisol equals more plaquing. And this was just a study that showed that cyclists who didn't get any kind of piezoelectric effect had more osteopenia. That's fine. Now, let's get into the products. And the thing I think I want to do before I get into the products and the aged garlic, I want to pick up this study. And I'm not going to go through a lot of this, guys, but this is brand new stuff. I mean, you got to love this. So this is Dr. Budoff at the International Science Symposium for Garlic. I know Dr. Budoff is a brilliant researcher. This is obviously the improvement in microcirculation by garlic. This was actually proven back in 1994, that when you gave aged garlic, it improves endothelial function. This was done with pictures being taken in around 90 to 120 minutes. So if you think of a real value, is anybody that you know of that has high cortisol and their blood pressure is starting to give them problems, right? You want to think of aged garlic because the improvement in peripheral blood flow. This was aged garlic with B vitamins and retarding the progression of subclinical atherosclerosis. This was a study that was online in 2009 and I think published in 2010. It was Division of Cardiology at the Harvard UCLA Clinic, and then also the Division of Cardiology Vascular Medicine program at University of California, San Diego. So very interesting. And basically what they showed when you were thinking of the time to recover from arterial occlusion, dramatically improved when you were on aged garlic versus the placebo. So this really does help with endothelial pliability. And in this particular case, if you look here at the deflation of the cuff, it's the time to get circulation back significantly improved once again with aged garlic extract. I kind of want to get to the other results. These are the circulation results, but I really want to get to, if you guys don't mind, is this. So epicardial fat, pericardial fat. This is annual coronary artery change, annual total fat change, and then annual white change in fat. And this is a 2013 study. So it's the effect of CoQ10 and garlic on endothelial function. This is the FAITH trial, showed calcium regression 53%, endothelial function improved by 90%, 90% improvement in endothelial function. So if you guys are doing endopat, everybody ought to be getting on aged garlic, a minimum of 1,200 milligrams a day. And if you look at the CRP, it went down. And this is just kind of, I don't really want to go through this because this is the whole thing of how they do the study. I want to get to the next study, bone mineral density with aged garlic extract. So bone mineral density and coronary artery calcium. So if you look at the aged garlic, it says plus S. S is methylating B vitamins and arginine. This is placebo. So this is the absolute annual change. So as you look, bone mineral density was basically, you stopped bone mineral density loss and you significantly decreased coronary artery calcium versus the placebo. This was a 1-year study, by the way, just in 1 year. And you look here, the likelihood to improve endothelial health, decrease homocysteine, and slow progression. So the likelihood, if you look at males and females, it's a pretty dramatic, likelihood, which is great. And then if you look at epicardial fat and pericardial fat, I want to get to the liver and spleen as well. So what he's saying is when they do their coronary artery score, they see the liver, they see the spine, they see the fat around the heart, and then they look at calcification. So they looked at all those parameters and measured them when they gave aged garlic extract. When you looked here, no patients on active therapy formed NAFLD, while 9% of the patients on the placebo developed it. So you had 9% of people to develop in that 1 year fatty liver disease, whereas nobody on the aged garlic did. So significantly associated, here's another big one. You hear Dr. Houston talk about the ApoB versus ApoA1 ratio. So it has a significant improvement in that ratio. So this is, once again, really big data that's showing that aged garlic has this traumatic impact. Why am I pointing at this? Because cortisol is one of the big instigators of triggering a lot of these issues that happen in cardiometabolic risk. If you look here, you see this is just the data on the ApoB. I'll get by that. So 72 patients randomized with Kyolic or placebo evaluated for non-calcified plaque, so soft plaque, evaluated for carotid intimal media thickness, coronary calcium, biomarkers, blood pressure. Once again, what do they see? A significant change in regression of plaque. And this was in people that were not treated with statins. So I literally just got those slides today, guys, so I haven't even got the chance to review them much. I just wanted to be able to show you that. That is incredibly exciting, that garlic, when given alone or given with statins and aspirin, dramatically improved the plaquing, reduction in plaquing. And then, so the benefits, obviously with cholesterol, it lowers oxidized LDL, it improves the ApoB to ApoA1 ratio, reduces homocysteine, reduces sympathetic tone, which I'm going to show you in a minute. So the benefits get into bone, liver, vascular health, and fat. That's cortisol. When you think of what cortisol is doing, those are all the kind of spidery, complicated metabolic issues that are going on. Yeah, people get anxious, they get depressed. They also become vasculopaths, and they also end up with higher risk of heart disease and Med-S when their cortisol is high. There's also some early evidence that aged garlic helps with the HPA axis, and that may be one of its mechanisms. So I just want to get out of that. I think this was pretty cool. And let's get back to our presentation. You can see I've been writing a little here, guys. Let me get back to here. So I just want to take the time to go over ingredients and how to use them. I mean, so much of the time we go through, presentation and science and all these shifts in chemistry. I kind of wanted to spend more time on products. So the first one, that's what I actually made this slide before I got the slides. I got them sent to me after I turned this in. So lowered adipose tissue around the heart, regressed coronary calcification, stopped bone mineral density loss, regressed fatty liver, and prevented fatty liver in people that that ended up developing it in placebo. And then, of course, it has all the other traditional benefits that I'm going to show you in the preceding slides. Take a look. Blood pressure changes systolic 6 to 10%. The last study being University of Adelaide, I'll show that in a minute. So if you just go through this, when I showed you what elevated cortisol does, elevated cortisol raises blood pressure, it lowers HDLs, it raises small particle LDL, it causes more oxidized LDL, it creates more platelet adhesions because of the increase in epinephrine, norepinephrine, and insulin. and it causes more triglycerides to form. And then in addition to that, vascular elasticity and coronary artery calcification occur due to the bone mineral density loss. So when you look at what's been shown in human trials with aged garlic, I think it's important that if you're not using it, you got to be using it. I use it all the time. I've been taking it myself for quite a while. And these are just some of the double-blind controlled studies. If you look here, this was liquid in the top one, 4 milliliters. So it was 4 milliliters a day, or a total of 1.2 grams a day. Progression in coronary calcification went down by 65%. That was a 2004 study, then repeated again in 2006. The average calcium score at baseline was 550. So this just isn't stopping it in the early folks. It's really slowing down progression in the people that have got advanced calcification. I think that's important. And the folks with the high cortisol are really doing a great job of plaquing those arteries. Next study was using folate, B12, arginine, and aged garlic extract at a total of 1.2 grams a day. And you guys can look at this. I don't need to read through these, but look in the box. Coronary calcification goes down 78%. HDL up, LDL down, homocysteine down 18%. Look at the oxidized LDL, guys. We know this is working on myeloperoxidase. I just haven't seen it yet, but it's got to be, right? And so oxidized LDL in this human study, not rat, 35 to 69%. And I might add, if you look to the far right, this is presented at the American Heart Association scientific session in 2010. This is really high-grade science on an agent that whenever you see high cortisol, you want to be thinking, I should be giving aged garlic extract preventatively. Look at the next study. This is another one at 1.2 grams a day. So I guess you guys are getting the idea. The dose is 1.2 grams a day. I use up to 2.4 grams a day, but a lot of people use different ones. This particular study, if you look, CRP goes down 69%, vascular elasticity improves, vascular function improves 65%. These are the classic things of the person that's been under sustained duress, and now they've got cardiovascular problems. The endothelium is stiff, they're insulin resistant. You'll note in a minute why it improves insulin resistance. These were the studies by Dr. Reed at the University of Adelaide, and basically what it showed, people with resistant hypertension got an average of about 8-point drop at 2 caps a day. They got an 8% drop in their blood pressure. Actually, they did another study at 4 a day, and they got a 10% drop. So this is big. So next thing, adiponectin levels go up 10%. Why is that important? People that have high cortisol and store belly fat have less adiponectin released and more resistin released. The more adiponectin that you lose, the more that you lose your insulin receptors functionality and ability to regulate glucose and regulate that visceral fat storage. That's once again at 1.2 grams per day in humans, not fat rats, in humans. And we don't, I don't need to go through that anymore. Adiponectin, this was the other. I think this is the same study. I think I just duplicated that. Sorry. This just kind of finishes up what the multiple benefits are. You guys can look at this. Certainly we'll have this posted for you. You'll be able to review all these slides. But I don't know if you look at that first slide that I talked about cortisol, this really mimics the metabolic effects of cortisol in your body. And probably more important than giving any other single thing, more than Relora, more than theanine, more than kava, more than adaptogens, this is regulating the metabolomic expression of what's going on when the cortisol is up. Because the damage has already started a lot of times. And so you just want to keep that in mind. It's kind of why I want to take a different spin on cortisol tonight, because I think we just get so focused on what's the next hot herb that lowers cortisol. Oh, it's sensorol, it's ashwagandha. Oh, no, it's not that now. No, now it's a new mushroom, right? It's the Stantia tuberosa. You've got to think about once the cortisol triggers your metabolic pathways, how are you going to reset those? Just because you get the cortisol back in line doesn't mean you stop the bone demineralization all the way. Not if you're not monitoring pH and you're not monitoring what else is going on. So just important to note. What's the next thing? The next one is glucose metabolism. When your cortisol goes up, your insulin goes up. And your glucose levels go up. The single biggest plaquing process is postprandial hyperglycemia. How do we get postprandial hyperglycemia down? We can teach people how to eat right. This is an interesting product. This was developed by Metagenics. It's called Ultra Glucose Control. It marries a product that I talked about a few years ago called UCAN, or super starch, to a protein and other branched chain amino acids. So what does it do? The big thing that this does is that it keeps glucose spikes down and keeps you from creating more insulin resistance, because it manages the slow release of glucose into the cell. But interestingly, with the added protein and branched chain amino acids, it helps with tissue anabolism, a hallmark trait of hyperinsulinism, metabolic syndrome, and in high cortisol, right? People get catabolic. They're not anabolic. So this really helps the mitochondria to be able to shuttle the fuel correctly so it can be burned, and which is incredibly important. That means that the liver does better, the pancreas does better, you get better healthy muscle and better lean weight. I mean, this was studied at the Joslin Center at Harvard. So if you see this, Joslin Diabetes Center looked at this. They're big believers in a 40-30-30 diet. I think you can get by with a 40-30-30 diet when you use something like super starch. I think a lot of people, as you guys have learned and have seen, need lower starch diets to begin with in order to break their insulin resistance, and then they can move to that 40-30-30 adjustment, which is where a lot of people end up after 2 years on their diet. I'm sure Laura went through some of that data with you guys. And so this is that whole thing of balancing protein and what happens. So resting blood sugar induced glucose intolerance, what's the effect with diet? So basically what they did was they did a diet of 60-20-20 carbs, fat, and protein. That's diet 133. And so what you saw there was that you had more insulin resistance at 4 weeks on that diet. 134 was a 60-27-13, so 27%, and then 13% on the fat. And then look at diet 135, which is 60% carbs, 33% protein, 7% fat. So basically, the more you can get protein in, the better off you get. So normal protein subjects were more glycemic and more insulin resistant. More protein was corrective and required less insulin. So you need higher protein than the normal protein that is given. This is kind of cool. This was this was a rat study. These are but this is healthy pancreatic cells on the left, 4 weeks with balanced micronutrients. So basically, what you saw was healthier pancreatic islet cells. If you look at the failure, those are the ones at the bottom. High carb, no balanced macronutrients, meaning it was a higher carbohydrate diet, not enough protein, and not as much fat. And so you can see the beta cells fail, and that's what this is showing. And I'm not going to we don't need to worry about this. You get diet and lifestyle factors, that's fine. But I really want to get through the fact that as the mitochondria get dysfunctional, you get more oxidative damage, you get damage to the protein and lipid membranes, you get more DNA damage. That's why you want to measure deoxyguanosine, right? Deoxyguanosine is a great marker for DNA damage, and you can find out how well that insulin-resistant person, high cortisol person is. And then, of course, this leads to insulin resistance. The next thing here is if you look at this super starch with protein, look at the blood glucose level given. This is given to people. So this was at the this is the Functional Medicine Research Center at Metagenics, actually. So if you look here, look at the glucose spike. There is none when you give UCAN versus just giving regular carbohydrate load. 50-gram glucose bolus is what it is. And then this is UCAN at 50-gram starch, but it releases slowly. It has all kinds of metabolic effects that are positive. And this is, of course, the amylopectin. It's gluten-free, non-GMO, high molecular weight, low osmolality. It goes through at a very slow rate. Look, guys, it's one of the problems that you have when people eat a lot of grains, even when they're whole grains. Even with all these, grains that are now milled down to such a fine mesh, when people eat them, they get across their gut and they act just like sugar. So slowing down that process of the blood sugar spikes is incredibly valuable for what's going to happen with their postprandial hyperglycemia and the way they're going to plaque. So when you have high cortisol people who are dysglycemic, meaning they're complaining of, I just had one today, I have to eat every 2 to 3 hours or I get irritable, I get shaky. High cortisol and also dysglycemia. You want to think about altered glucose control. In addition to for diabetes, it's obvious. They did studies in people with diabetes. This improves their blood sugar and it reduces their boinks at night, even in type 1 diabetics. I'm talking about for that person who's highly driven, cortisol, I don't eat lunch, or before I know it, I'm nibbling on something and I'm mowing through a thing of, a bag of tortilla chips, or I'm eating through a row of cookies. This is a great way to neutralize that because it balances their postprandial spikes that they get from elevated cortisol and dysglycemia. And this just kind of goes through. They add branched chain amino acids to it. Why do they do that? Because it improves anabolic potential on the muscle. So it's stimulated more GLP-1. They get more anabolic drive on the muscle, meaning branched chain amino acids were improved. So this particular product has whey protein, it has branched chain amino acids in it, and it has superstarch all in one. It's kind of pricey, I'm going to admit. I mean, it's kind of pricey because it has all that stuff in it, and none of it's cheap. But it really does the job for people that you're having trouble getting to manage their weight or trying to balance that effect of that postprandial spike. This is just kind of more of the same, it talks about, we kind of can go through we can get through this slide. And so honestly, think about this for your high cortisol patients. Because here's the thing to remember, if they're still dysglycemic, when they're plummeting with their dysglycemia, they're triggering more cortisol release. So you can give them adaptogens, but if their blood sugar's not under control, you still don't get control of what's really going on with them. And so these are just extra slides that you can look at your own time that kind of shows you the adjusted plasma changes that occur and the slowest rate of return to baseline versus the best rate of return to baseline. And if obviously ultra glucose control, or this UGC, has the best parameters as it relates to that. And I just want to kind of click through this. So you have the smallest hypoglycemic response, which is what you're looking for. And this is what the product looks like. You can get a big bag. It's got 4 grams of fiber, which is great. It's rice and pea and branched chain amino acids. And I think it's fantastic. I really do like it. Next thing, this is where we start to get into when do you use product for what time. If people have elevated cortisol and they have trouble with perseveration, this is one of the products that's in the software platform. So you can use what you want. You look at the ingredients, guys. You can give people a 5-HTP. You can give people theanine. You can give them some ginseng. What's the rationale in this? One, you're building serotonin, so you're going to decrease craving patterns. You still have the folate and the B12 in it, which is great because you improve methylation, and so you can take that 5-HTP and you can make it into serotonin as well as some dopamine. But then you've got a little bit of an adaptogen in it, nasine ginseng, kind of buffer the stress response, and then theanine, which obviously anti-glutaminergic, helps to balance GABA, helps with reducing the signals of the phenylethylamine so the perseveration goes down. It's a pretty interesting product, and that's a 1 capsule contains. So, and then of course Chinese skullcap also helps to calm things down. So it's a very interesting compound. It's why we put it in the program. It's a new product from Metagenics. Other important products to think about. I know I want to leave time for you guys to give me questions, and I know we're at about an hour. Is adrenal build. When do you give Sericin? You would give Sericin if somebody's alert in the morning, but not agitated, not anxious, not craving. You may think, and they say, you know what, after lunch, God, the wheels start to come off the cart. I start feeling overcommitted, anxious, nervous, and then I have trouble sleeping at night, and in the evening I eat too many carbs. You would think about giving Sericin when? At the noon, 5, and 8 p.m. time. If in the morning they wake up right away and they're feeling anxious and they're feeling overcommitted and they're craving, they got to have high carbohydrate breakfast, you may want to give it in the morning. So, but typically, you think about how am I going to measure those 4-hour segments and figure out what to give. When are you going to give adrenal build or an adrenal gland extract? This is a whole gland extract. So whether you're using, Thorn or PHP or whoever you're using, right? You use adrenal extract, whole gland adrenal extract, when somebody is tired and fatigued, meaning that they're not wired, they're not excitable, they're not anxious. Because when you give a whole gland extract, you're going to stimulate norepinephrine and epinephrine. It's going to help them with their alertness. For example, my executive that was 45 years old that was sitting on his couch with his 3 kids and didn't have the energy to play with them by 6, he got home at 6:30, 7 o'clock at night. I gave him, an adrenal extract that, with some B vitamins in it. Gave him something to regulate his glucose. 5 days later, I'm talking to him, and he said, "I can't believe how much different I feel. I feel so much better." That's that person that's tired and flat. They're fatigued. They're worn down. They're not thinking straight. Right? They're a little bit dysthymic. You think of adrenal build, whole gland extract. If they're tired and wired and their cortisol is low. First of all, when are you going to give them adrenal build extracts? You give it to them in the morning and you give it to them at noon. And if they're tired in the morning, I give them 2. If they're tired at noon, I'll give them 2, meaning 200 milligrams to 400 milligrams twice a day. Or if they're fine in the morning, I give them 1 and I give them 2 at noon. I do not give whole gland adrenal extracts at night. Don't give them in the evening. Now, if you got a night shift worker, that's different. When would you use adrenal cortex? When you don't want to stimulate norepinephrine and epinephrine. So if a person has low cortisol, but they're anxious and nervous, you think about adrenal cortex extract. And typically, I do the same thing. So, 250 milligrams, 1 or 2 capsules, morning and noon, to start to remodel how their diurnal rhythm looks. So if they're low in the morning and low at noon, boost it up. If they're low in the morning and they're high at noon, boost the morning up. Give them something like Saracen, or give them something like the next thing here, Still Point or Kava. You want to think about what you're trying to do in those 4-hour segments for that person, because you have to re-regulate their diurnal rhythm. So the next thing that so there's whole gland adrenal cortex. The next would be when you have someone who has high cortisol and low testosterone. And I see this all the time in men. I love uricoma. And another male, 43-year-old male, that said, "Hey, my morning erection back. I can't believe it." Using uricoma. He had high cortisol. He had a fairly low testosterone. It wasn't like a 120, but he had a 350 with a high sex hormone binding globulin. But when it gave him uricoma, and he got, you give 200 to 400 milligrams of uricoma, you're going to get results. And you could give some Tribulus. I find Tribulus works good with uricoma. And it works for women, too, for getting their testosterone back. If their cortisol is high and they don't have testosterone, the studies they've done in women show it improves it. It improves their mood, improves your strength, improves your sexual interest. So uricoma is, you want to think about when you see a high cortisol and low testosterone. And you can combine that with doing something like that Saracen or this Still Point, which is, look, once again, there's 10 companies that have Relora. If you don't use Still Point, you can use something else that's Relora. I like Still Point because it has Relora and evodimine in it. And why I like evodimine is it helps to build serotonin and dopamine. And why I like Relora is that it helps with craving patterns in addition to working on GABA A receptors and adenosine A1. If I've got somebody who's anxious, nervous, agitated, I think of using Relora and evodimine, especially if they're craving foods. Another adaptogen you can look at if you don't want to use, is Adracet, which is from Metagenics. I would use this for people that you're looking more on maintenance. So, hey, I've got somebody, they're doing okay. cordyceps, Asian ginseng and rhodiola is a nice combination. I'd say they could do 2 or 3 capsules a day. And this is for that person that you've kind of worked through their big spikes and drops in their diurnal pattern. And then this is the adrenal adaptogen, the compounded nutrient makes. You use this for that person that's a little more down the path of being exhausted, but maybe it's somebody who's doing CrossFit workouts, or they're in a lot of mental capacity work, right? They need more rhodiola. They need more, they need the cordyceps for the oxygenation. They need the uricoma so they keep their sex hormones intact. This is for that person that if you're looking for an adaptogen, it's a little more intense. And so obviously there's other things that you can give them as well. I just wanted to kind of go over the big ones. So if we have any questions on application of the product or the thought of aged garlic, I mean, I would love to get feedback from somebody on what they thought about the aged garlic study. I'm open for questions.
Okay, we've got everybody's microphone muted by default, but if you want to raise your hand or type in a question, we'll unmute your microphone so you can ask a question. I've got one already, so let me see where that's coming from, and I will present that to you, Jim, in just a second. Let's see here. Who's got their hand raised? Okay, Mark Davies has a question. I'm going to unmute his microphone. Go ahead, Mark.
Okay.
Okay.
Mark?
Mark, do you want to ask your question? You're unmuted.
Can you hear me okay?
Yeah, perfect.
Okay. Hey, Jim.
Maybe turn down your microphone on your.
Jim, I'm gonna.
Perfect. How you doing?
Good, Jim. I'm going to mute you while Mark asks his question, just so we don't have the.
Oh, perfect. Okay, good. Great. Go ahead.
Go ahead, Mark.
Can you hear me okay?
Yeah, we can hear you fine. I think for some reason your microphone is echoing pretty badly, but go ahead with your question.
What about we're using phosphatidylserine in the nighttime for high cortisol.
Yeah, so I love phosphatidylserine. In fact, I have it in the Restore Tea, the Tribulus product. You can put phosphatidylserine in it. I love phosphatidylserine for lowering nighttime cortisols. I love phenibut. So one of the things I didn't talk about, because we did it in the sleep, I didn't want to be redundant, was you use the slow wave, or you just get some phenibut, add that with melatonin, and then if they're still having trouble, you look at phosphatidylserine. I love any of those are great strategies. But you got to get that nighttime cortisol down, or you'll never get the diurnal pattern to recorrect in the morning. That's why I'm big on using so much melatonin. So if you weren't available for listening to the sleep talk, try to listen to that one, because I got a lot of positive feedback from everybody on it. Go ahead. Any other questions?
Okay, so if you have a question, please raise your hand, or you can type a question into the chat box or the private message box. One of the questions for Mark, again, was thoughts on THC or CBD for lowering PM cortisol.
I know everybody's jumping on the cannabinoids. I just have issues with the fact that I know there's certain people. I'm just dealing with somebody that's having withdrawal problems, like major withdrawal problems. So it's just early for me anyway. I got so many other things that are easy to use that I don't have that. I don't have that trepidation over the fact that there are, if people are using THC because it's legal in their state. There are a certain amount of people that end up with psychosis, and so I'm not a big fan of the movement right now. Now I do realize that the cannabinoid receptors have got a tremendous amount of promise. I'm just not there yet. So and I'm sure it'll come out and it'll be good to apply. I'm I've got so many other things that we can use that are easier to deal with. So that's it. So, no negative comment. I just have been very reserved in that area to date.
Okay. So, Jim, I'm going to take another question here that I want to just answer with a general response. Someone said, will the webinar be available on the website for review? And the answer is that yes, this webinar has been recorded and will be available for a limited time at metaboliccode.com, along with some of the other webinars. They'll be archived after that. If you're a subscriber to Metabolic Code System, which we'll talk about tomorrow night, you'll have unlimited access indefinitely. So be sure to send an email to admin@metaboliccode.com if you're not already registered for tomorrow night's presentation about that. Jim, another question was, can you comment on vasectomy and hormone?
Well, I mean, obviously, there's some men don't do as well with a vasectomy, and so it alters their production of hormones. So I don't know about the central regulation of that, so I'm a little bit hesitant to take a guess at it. So I can't offer a strong opinion on it. I just know that I've got men that have had vasectomies that have had problems with their testosterone levels.
Okay. And then a female question from John Mallon is a patient with high testosterone, or high T, it says, high morning cortisol, very low noon at 4 p.m., but normal in the evening. I don't know if there's a specific...
She's a female with high testosterone, so I would be suspecting insulin resistance right away. Is this a PCOS case?
John, your microphone is open.
Hi, Dr. Lavalle. How you doing today?
I'm doing good.
Good, yeah. She's got very high T, and then in the morning, her cortisol is very high. Around noon, 1 o'clock, it drops. I mean, really drops, and stays flat for the rest of the day. So it appears to be normal towards the end of the day, only because that's when the normal curve drops.
Right. Right. Well, is she insulin resistant?
Yes.
Yeah. So that's a classic pattern of, she's kind of got that. And does she have PCOS or no?
She doesn't. She doesn't really have any other signs other than
okay.
just the
all right.
tiredness,
So,
no hair growth or anything like that.
Okay.
And
so I would.
Belly fat too.
She does have belly fat?
Yeah, she does.
Yeah. So you know what? I mean, the big thing I would do on her is I would really emphasize a low carbohydrate diet and get her carbs in the evening. Try to switch her leptin regulation, and then does she sleep well?
No.
She doesn't sleep well, yeah.
No.
So the next step is that because she's really in that kind of mixed pattern, right? She's high in cortisol in the morning, but she's high in cortisol in the morning because she has to get up, and she's still at that phase where, because she's got poor sleep and her insulin is dysregulated, her cortisol goes up. I'll bet her morning blood sugars are like in the 90s. Just to keep her brain moving, right?
It's 85 is what.
It's 85. Well, I'd love to see her insulin. I mean, because there's got to be with belly fat, there has to be, if her glucose is still playing out as being normal, she's got to be producing more insulin, and you have to give her like a 50-gram carbohydrate bolus, rice cakes and jelly, and then measure it an hour and 2 hours later and see what's going on. But what I would do then is I would try to dampen her cortisol in the morning, right? And so you want to think about dampening her cortisol in the morning, and if she's not sleeping well, try to re-regulate her nocturnal hypercortisolism, which would be phosphatidylserine. You could think of phenyl-GABA, but really importantly, melatonin is the compound that causes the signal for sleep and causes the patterning of the corticotropin releasing hormone for the following day.
Yeah, I've got her on 12 milligrams of melatonin slow release.
Yeah, so I would, if she's still not sleeping well, I'd give her 10 milligrams immediate release, sublingual. I'd give her another 10 slow release, and then I would add 200 milligrams of phenibut to it. So you use phenyl-GABA, and then if that's not working, you can even think of using something like, if her HPA axis is, she's emotionally been traumatized, or she's anxious or nervous, or she has some kind of like fibro-type characteristics, you could think of something like Neuromedulla, which is a product from Professional Health Products that does a really good job on remodeling the HPA axis. I mean, people really do a great job when we get them on that. And you got to start there, and then the testosterone might be a separate issue. It's a little bit, I'd get her cortisol right first, get her blood sugars right first, and see how her testosterone comes out. You certainly could put her on things like saw palmetto
Yeah, I
and
did.
try to adjust that, right? I mean, you
In
could
two
do those
days,
things.
in just 2 days with the salpimento, she's noticed a big difference.
Oh, great. Yeah,
No.
that's a slam dunk. That works a lot of the time, right? So
Mhm.
that's great. But that's what I'd be doing. I'd really try to increase that nighttime, and then support her during the day because she's flat. If she's flat and fatigued in the middle of the day, you got to give her something to bring that up, and you can choose either to try an adaptogen, or you may give her a little bit of adrenal cortex if you don't want to get her norepinephrine, epinephrine up. So you want to try and balance it in 4-hour cycles. I think if you get the cortisol to come down in the morning, more than likely what will happen is the afternoon will shift appropriately. She's just jacked and she's not getting sleep. Anybody else?
I mute my microphone. Hold on. Her question was, how long were the studies studying the use of kyolic for effects to appear?
What? Well, all the studies were 1-year studies. However, when I used kyolic, and I would look at rouleau formation in the blood and fibrin formation in the blood, so I'd stick their finger and look at their red blood cells and see how sticky they were, and saw how long it took to start making fibrin. Within 30 days on kyolic, and somebody would come back in, I'd stick their finger and I would look at their blood, and their red blood cells would be floating freely. It'd take much longer for the fibrin to form, so the cobwebs weren't in there right away. So in as little as a week, you'll see a difference in peripheral blood flow. The peripheral blood flow studies were shorter in duration. But if you're looking at the lasting studies on the heart, that's more of just the studies went a year. So if you ask how long did it take for the study results, it took a year because the study took a year.
Okay, great. Any other questions? We can take one or two more. And I want to remind you that you can learn more about this and find the presentation recordings at metaboliccode.com, as well as upcoming events on the events page of metaboliccode.com. And if you're not already subscribed for tomorrow night's presentation on introducing the Metabolic Code system, please do send an email to us at admin@metaboliccode.com. Any thoughts, Jim, on alpha GPC on stress response?
Sure. I do want to mention we are going to start interviewing experts as part of this process. So every month we're going to have a noted expert in the field that I'll be interviewing or Dr. Heyman will be interviewing. So that's kind of a new thing that we're going to be starting here in the next month. Alpha GPC, here's where alpha GPC fits. You see, if you're looking at the slide that I'm on right now, alpha GPC increases growth hormone release because it increases acetylcholine. So when you think of using alpha GPC doesn't necessarily downregulate cortisol dramatically as much as once you're dampening cortisol and you're trying to get your growth hormone to start to function again, kind of get the diurnal pattern of the growth hormone back. Alpha GPC at night, alpha GPC in the morning is a really smart strategy. Typically 1,200 milligrams twice a day or 2,500 milligrams minimum at bedtime. And I used it in powder form, so I would give a half a teaspoon to someone, and it works really well. I mean, so it definitely helps in that light, and obviously it helps with memory. So it's helping with the damaging effects of cortisol, because the acetylcholine kind of acts to drive that memory center in your brain.
Well, great, Jim. That was another great presentation. I want to thank all of you for coming. That's the last question that we had tonight, and I'm glad we were able to keep it to a time that was reasonable for everybody. Jim, thanks for keeping it so concise. And we'll be, again, releasing the recording of this on metaboliccode.com. Please join us tomorrow night for introducing the Metabolic Code. And Jim, any last thoughts, or else we'll close out the recording for the future?
No, my last thoughts are simple. Please look beyond managing the obvious signs of metabolic stress due to cortisol. Look at the expanded problems when people have been under duress for a long period of time, and that gets into the whole cardiometabolic complications that occur and vascular complications, bone loss, all of those different aspects. Just keep it in your, in your front foresight when you're measuring cortisol on people. And I hope everyone has a great night and hopefully a lot less stress tonight.
Awesome. Well, off to bed, everyone. Thanks again, and we'll see you tomorrow night. Thanks, Jim.